Welcome to Module 4, Data Access Management and Visualization. In this module, we'll explore how to effectively collect, manage, and use data to inform every stage of the CHA-CHIP process. You learn about trusted data sources, explore data management platforms, and discover how visualization tools like dashboards can turn numbers into insight. We'll also look closely at how to use data to advance equity, because how we collect, analyze, and display information directly shapes our public health strategies. So let's dive in. Data plays a foundational role in the CHA-CHIP process. Without it, we're making assumptions. With it, we're making informed decisions. This slide introduces two key concepts: understanding the role of data and knowing where to find it. Data helps you define problems, prioritize issues, and measure impact over time. It also helps engage stakeholders by showing a shared reality and tracking progress. We'll cover where to find quality data, local, state, and national sources, and how to evaluate them for credibility, relevance, and accessibility. Data is foundational to the entire CHA-CHIP process. It ensures our public health work is grounded in evidence rather than assumptions. It guides our understanding of community needs, sharpens our priorities, and gives us the ability to measure progress over time. In the community health assessment, data helps us answer essential questions. What are the health outcomes in our community? Who's most affected? Where? What are the underlying causes of these outcomes? In the Community Health Improvement Plan, data is used to develop goals, set benchmarks, and evaluate whether strategies are working. Without data, we can't justify our priorities or track the impact of our work. There are two key types of data: quantitative data, such as vital statistics, hospital discharge data, EMS runs, and survey results like BRFIS or YRBS. These tell us the what, where, and how often. Qualitative data, including focus groups, interviews, open-ended survey questions. These help us understand the why, what people are experiencing and how they perceive health challenges. This broad base of data allows us to tell a compelling, credible, and actionable community health story. Importantly, this work aligns directly with FAB Domain 1, which emphasizes population health assessment and the sharing of findings with stakeholders. It also supports Domain 9, which focuses on performance and quality improvement, ensuring your strategies are both evidence-based and continuously evaluated. Ultimately, data allows us to make better decisions, build stronger partnerships, and ensure that our health improvement efforts are targeted, equitable, and effective. So let's talk about where we actually get the data to build a strong community health assessment. So a high-quality CHA relies on multiple diverse sources of both quantitative and qualitative data. These sources provide a more complete, accurate picture of population health. Some of the most common and useful data sources include vital statistics such as birth and death records. These are great for trends in maternal health, infant mortality, or chronic disease. EMS data and emergency department visits. These offer insights into injury, overdose, or acute conditions in near real time sometimes. BRFIS, or the Behavioral Risk Factor Surveillance System, has information about adult health behaviors. YRBS, or the Youth Risk Behavior Survey, has similar information for school-age populations. Census and American Community Survey data for demographic and social determinants like income, housing, and education. Hospital discharge data has some ICD codes for chronic disease, behavioral health, injury. And then there's other data sources like WIC, Head Start, food banks, housing coalitions, schools. These might help you fill some critical gaps and highlight equity issues that national data sources may miss. Your data sources should reflect not only what's available, but also what matters most to your community. This aligns closely with FAB Domain 1, Standard 1.2, which requires use of both primary and secondary data to describe health status and factors influencing health. It also supports equity by ensuring multiple perspectives are reflected, particularly those of vulnerable or typically underrepresented groups. So technology tools are key to managing and analyzing your CHA data, especially when dealing with multiple sources or large data sets. For data collection, platforms like Google Forms, Microsoft Forms, or SurveyMonkey allow you to gather primary data through community surveys quickly and securely. Tools like ESRI's Survey123 lets you collect geotag data in the field, which is great for environmental health or mapping assets. Focus group transcription tools or AI-assisted note takers like Otter AI make qualitative analysis easier and more accessible. For data analysis, programs like Excel, a basic but widely used platform for cleaning and organizing data, SPSS, often used in epidemiology for more complex statistical analyses, and R and Python, those are powerful for custom analysis and visualization if you have more advanced users on your team. Ultimately, selecting the right tools depends on your team's comfort level, time, and goals. The key is choosing technology that enhances, not complicates, your ability to use data to drive decision making. These tools are also critical for preparing documentation that aligns with FAB domains 1 and 9. Once you've collected your data, how you manage it becomes just as important. Effective data management systems ensure your information is organized, accessible, secure, and usable. This is especially important for teams that share files, work across programs, or need to revisit CHA materials during accreditation or planning updates. Common tools include Excel and Google Sheets. Those are useful for small data sets and quick summaries. SharePoint, Teams, or Google Drive. It's useful for cloud-based storage and access control. MySidewalk or Tableau for importing, linking, and interacting with live data sets. REDCap or EpiInfo if you're collecting structured survey or surveillance data across multiple locations or over time. Your management system should support data versioning and backups, allow users to tag or sort files by CHA stage, topic, or domain, and include standard file naming and storage protocols. This directly supports FAB's emphasis on transparency and preparedness, being able to show how data is accessed and managed over time. So something else I just want to highlight is collaboration examples. You can look at academic partners analyzing zip level SDOH trends. You can look at a state team providing de-identified claims data sets for local health department use. There's all kinds of opportunities for collaboration out there. They sometimes come with a price tag, sometimes they don't. But you should explore these opportunities. Visualizing your data is one of the most powerful ways to engage stakeholders and inform decision making. But so many of us are less than well equipped to be able to do this. There are a range of platforms you can use. Excel and Google Sheets, those are great for just simple graphs, bar charts, handouts, presentations. Take a little step up to Power BI and Tableau. That enables more interactive dashboards that update with new data, allow users to filter by region, age group, or indicator, or whatever other characteristic you set up. MySidewalk is designed specifically for public health use, with templates for mapping, storytelling, and embedded dashboards. On a more advanced team, you might look at Python with Plotly or Matplotlib, or R with ggplot2 or Shiny. These are really useful for producing customized and complex visuals. You can also develop dashboards using Python, and there's some really nice tools out there for doing that. Ultimately, you want to choose your platform based on the story you want to tell and the technical skill level of your team. You don't need to be flashy, just effective. Good visualizations make your data more accessible, actionable, and relevant to diverse audiences. And that's what's most important. You want to make sure to include community members, elected officials, and partner organizations. So the technical aspect of putting these things together, it's fun for some of us, not so fun for others. Ultimately, what you need to do is tell the story. How you do that is based on you and your context. So, developing data dashboards for decision making. Something a lot of people always want to do is make a dashboard, which I totally understand. They're pretty cool. takes visualizations one step further. They're not just charts, they're decision-making tools. A well-designed dashboard helps track progress towards chip goals, visualize trends across time or geography, compare outcomes between subgroups to monitor equity, translate raw data into meaningful insights for both internal and external audiences. Your dashboard might live in Power BI or Tableau Public for interactive visualizations, or My Sidewalk for more ready-to-share community reports. LogicXML is another software that's out there, offers embedded solutions that can pull live data from your systems. Again, remember, a good dashboard doesn't just display numbers, it tells a story. It invites users to ask better questions, spot disparities, make informed choices that improve health. Dashboards also support ongoing alignment with FAB Domain 9, reinforcing a culture of quality improvement by tracking implementation and results over time. So now let's look at what makes a dashboard effective, not just visually appealing, but actually useful for decision making. A good dashboard includes a few things. 1, clear indicators, or key performance indicators, aligned with CHA-CHIP priorities. These might track obesity rates, access to care, behavioral health outcomes, or social determinants. You also want to be able to filter and compare, so users can explore the data by geography, age, race, time frame. This helps identify disparities and trends. Real-time or regularly updated data is critical, ensuring the information stays relevant and timely. Visual accessibility with clear fonts, readable color contrast, mobile-friendly formatting, annotations or narrative guides, which help users understand what the data means, not just what it says. Whether your audience is a public health team, elected officials, or community members, a well-designed dashboard simplifies complexity and supports action. That's why it's so important to be responsive on a mobile device, because so many of us just use mobile devices. That's why it's so important to have equity, be able to filter to see where the inequities exist, and ultimately have it all tie back to those key performance indicators. So let's highlight 2 Nebraska examples where dashboards help local health departments move from data collection to real-world action. So one I worked with was the North Central District Health Department. They used My Sidewalk to create a dashboard that displays health indicators and social determinants side by side. Community members were able to view trends by county or zip code, depending on the data source, and stakeholders used the dashboard to set priorities and build alignment. Lincoln Lancaster County Health Department also developed a LogicXML dashboard integrating CHA data and community partner inputs. The platform allows staff to track metrics for their community, flag emerging issues, and tailor interventions based on geographic needs. Ultimately, it wasn't rolled out, but I'm just presenting that as a concept where you can use a single dashboard. Public Health Seattle-King County's got a really excellent one, where somebody can go and really just explore all the data that you have out there. That's the kind of like magic side of the dashboarding that people think is like, how do you get so much information in one system? And that takes a lot of back-end and front-end planning, which isn't the depth we're going to go in this presentation. So addressing data gaps, inequity, and CHA reporting. So a high-quality CHA doesn't just report what's easy to find, it highlights what's missing and takes steps to fill those gaps. So data gaps often show up when smaller populations aren't reflected in surveys, qualitative feedback isn't collected or summarized well, local context is ignored in favor of national or state data. And to address this, we typically want to partner with community-based organizations to collect quantitative stories to bring numbers to life, disaggregate quantitative data wherever possible by race, zip code, income, or disability status, and include voices from groups often underrepresented in public data sets like immigrants, LGBTQ positive residents, or people without stable housing. This not only improves your child's completeness, it supports FAB's emphasis on equity and helps ensure your chip is designed for impact across the whole community. So again, equity isn't just about the data you collect, it's about how you present it. So you should disaggregate the data as much as possible by race, ethnicity, income, zip code, language. You should use visual tools, heat maps of chronic disease by census tract, overlaid SDOH scores and outcomes. You should avoid deficit framing. So instead of showing what communities lack, highlight strengths and opportunities for support as much as you can. Obviously, you want to identify where there's problems too. Choosing appropriate comparisons. Compare within groups or to relevant benchmarks, not just to state or national averages. And try to make your visuals people-centered. Try to make sure there's translations available when it's needed. And there's some common gaps to consider as well. Race is oftentimes missing from EMS records. Gender identity typically isn't captured. So there's certain things that we need to do better in data. And there's a lot of conversation about it, but it takes time. So it's just something to think about, is those data gaps and how do you fill those gaps. So let's wrap up. In this module, we explored how to use data to power your CHA on your chip, albeit at a very broad level and not super in-depth. But this should help you kind of start to explore trusted sources to using dashboards to drive decision making. We talked about why data matters for strategic planning and FAB accreditation. What are some data sets that tell your community story, tools and platforms that might support your analysis and visualization, the considerations of equity for reporting and presentation. So whether you're building your first dashboard or refining how you collect data, remember just that good data practice builds stronger programs, sharper strategies, more accountable public health systems. So the key takeaways from this module is that data drives the CHA on the chip. Strong assessments and improvement plans start with accurate, accessible, and well-managed data. Tools matter. From Excel to Tableau to MySidewalk, different platforms can support data work at different stages. And dashboards enable action. A clear, responsive dashboard helps leaders and partners understand what's happening and what to do about it. Equity should always guide your data decisions. Disaggregating data, servicing disparities, and using inclusive visuals are key steps towards building health equity. And FAB alignment. Domain 1, which is assessment, and Domain 9, which is quality improvement, are closely linked to how your department uses and shares data. These insights set the stage for stronger CHA chip outcomes and more meaningful community impact. So now that you've explored how to access, manage, visualize CHA chip data, let's talk about what's next. A few suggested steps you might want to take. Review your data sources. Make a list of what you're already using and identify some gaps. Look for those opportunities to strengthen your data collection and disaggregate where you can. Evaluate your technology stack. Are your data collection visualization tools still meeting your needs? If not, consider testing alternatives like Tableau Public, Power BI, or MySidewalk. Or maybe it's worth exploring some of those open source options like Python and R. Map your dashboard ideas. Start by identifying a few priority indicators and sketch a mock-up. What would your ideal data dashboard include, and who would it serve? Build equity into your data plan. Revisit who is represented and who is missing in your current data sets. Start small if you need to, but keep pushing towards inclusive, actionable data practices. Finally, share what you've learned with your colleagues and leadership. When the whole team's invested in good data, it becomes part of the culture, not just a compliance task. So coming up in Module 5, we'll move from data to people. Next module focuses on community and healthcare partner engagement, how to build trust, ensure representation, and create lasting collaboration during the CHA chip process. You'll learn how to strengthen relationships with hospitals, nonprofits, community organizations, engage underserved populations using culturally relevant strategies, conduct meaningful focus groups, listening sessions, and other participatory methods. If data is the foundation of the CHA on the chip, community voice is its soul. In Module 5, we'll bring those voices to the center. To support your learning and practice, we've included a full set of downloadable resources with this module. A data source directory focused on Nebraska, including local, state, and national data sets. A dashboard design template, so you can start mapping out your own CHA chip visualization tools. A comparison table of platforms like MySidewalk, Tableau, Power BI, R, and Python, including strengths, export options, and learning curves. A dashboard style guide with tips on color, fonts, layout, and equity in visual storytelling. A case study summary sheet featuring examples from North Central District and Lincoln's LogiXML draft dashboard, and readings on tools and best practices in data collection, management, analysis, and reporting. Use these tools to take action on what you've learned and to make sure your CHOT process is even more effective and inclusive. Thank you.